Mike, over the past several years, SickKids has been relentlessly focused on improving patient and staff safety through our Caring Safely initiative. Now, I've heard you speak many times about what patients expect when they come to SickKids. For the benefit of our viewers, can you speak to that a little bit?
Sure. Well, first, I think patients and families all come with their own individual needs that are really related to their own special circumstance. Having said that, I think patients and families come with an expectation that care is going to be safe. They may not say that, but I think it's understood when they walk through the doors that their child's not going to suffer harm. Families also come expecting that the care is going to be effective, that we're going to find the right diagnoses, do the right treatments, prescribe the right tests and medications. Beyond that, I also think they come expecting a certain level of service. They expect our care to be compassionate, to be culturally sensitive, for them to have access to our organization, for there not to be unnecessary waiting, and for each child and their family to be treated as individuals.
As caregivers, what is our responsibility for patient safety?
As caregivers, I think we all have two primary responsibilities. The first is to do the very best we can in delivering safe and effective and compassionate care to the children that we're caring for at that point in time. But we have another important responsibility, which is to contribute what we can to making the overall system better. Better for children, safer, more effective, more timely, better for families, being able to help them through the experience of having a child in the hospital and going through illness, injury, recovery, and also better for the staff to make it easier to deliver care in the highest quality, most efficient way possible.
I've heard you mention preventable harm. What is preventable harm?
Preventable harm really has two sorts of categories. Some preventable harm happens as a result of complications that are really a direct result of care delivery. As an example of that, it is common to have to put a catheter, a tube, into a patient's bladder to help them relieve urine. When that happens, that creates a risk of infection where bacteria can travel along the catheter into the bladder and cause a urinary tract infection. Although that's a very well recognized complication of that treatment, we also know that we can reduce the likelihood of that infection, that harm, through a range of very reliable, very structured practices. And so we think about that infection as a potentially preventable harm event. There's another category of preventable harm that relates to mistakes. Mistakes in treatments, mistakes in diagnosis, mistakes in communication. And we know that despite people coming with the best intentions and despite training and exceptional levels of competence, that even the best people can make tragic mistakes under the right circumstances. What we're working to do is to understand what are those circumstances that increase the likelihood of an error, and to try to build safeguards that help guard against those errors, and to promote greater awareness of where we can fail so that we can adopt personal practices that make us less error prone.
Can you tell me a bit more about those steps? What is the organization doing to reduce preventable harm?
Through the Caring Safely initiative, we're engaging all of our staff in a range of safety behaviors for error prevention that are aimed at improving safety in two important ways. One is promoting greater reliability and doing things in the safest way possible. The other is by promoting resilience, getting people to work better as teams, to communicate more effectively, to be more mindful of risks, and to be able to question things in a way that uncovers opportunities to prevent error.
And what about families? What role do families play in the Caring Safely initiative?
Families and even patients themselves can be critical partners in the Caring Safely initiative. As part of the Caring Safely training, we are working to ensure that our staff are receptive to the concerns that families raise, that they engage with them in partnership in trying to sort out what's going on. We also recognize that we have a commitment to families to disclose when preventable harms occurred and to share with them what we know about how an event has happened and the steps that we're taking to prevent something similar from happening again, as well as anything that we've had to do or will do to ensure that we've addressed the preventable harm in their child.
It's now been 2 years since we launched the Caring Safely initiative. What improvements to patient safety have you seen?
So we measure, as one way of tracking our progress, how often a child suffers preventable harm as a result of an error, as a result of a mistake. And what we've seen over the last 18 months is a 50% reduction in the number of those errors that we see in a given year. So that's a really quantitative, very direct measure of the success of the work that we're doing. Beyond that, we also see the cultural change that I think is at the root of that improvement. We see staff being more mindful of where the opportunities are to practice in a safer way. We see people communicating with a common language and a more structured approach to sharing information that is less prone to miscommunication. And we see a greater accountability for using the preventative measures that we know are effective in reducing infections and falls with injury and the other forms of preventable harm that don't tie directly to a mistake so much as the need to very reliably use a whole range of practices to minimize complications.
Looking ahead into the future, what's ahead for caring safely at Sick Kids?
We have set an ambitious target of reducing preventable harm from all causes by 2/3 over 3 years, and we're well on our way to that. But that target was not a final destination. Our goal is to eliminate preventable harm and to continue to reduce the likelihood that a child suffers any kind of preventable injury in this organization. And so we will continue to be more and more ambitious and to continue to promote the safety behaviors that we've introduced. We will also continue to make investments in safer care delivery through investments in equipment, information technology, and staffing in key areas to try to enhance the teamwork, the ability for people to do things in the most effective and safe way, and also the ability to share information more broadly, more quickly, and more effectively so that we can rely even more heavily on the teamwork that makes this organization really special.